Hey everyone, welcome to another episode of the Coach's Corner University podcast. I am your host, Paul O'Neid, coming to you again live from the hospital bed in my office. And today I'm joined by a dear friend, fellow coach with Master Athletic Performance and physiotherapist, Carly McInnis. Carly, welcome to the podcast.
Hello. Thank you for having me.
It's my pleasure. You know, you're coming to us from very, very far away now. You're not so close as you were before. Living in Calgary, Alberta, enjoying the bipolar weather that comes along with living by the mountains.
At least there are mountains, though. At least it's still pretty.
There is pretty mountains, nature, and a little bit more conservative politics, but that's a conversation for another day.
Yeah.
Maybe for people who don't know you, this is the first time coming on the podcast, but I've been wanting to make this happen for quite a while because I think you have a unique viewpoint on a few things. And I think starting with, you know, who you are, what your background is, your education, and kind of what you're doing now.
Yeah. So I originally grew up in Ontario. I want to say Toronto for people that don't know Ontario, but I'm not from Toronto. Spent my whole life there, did my undergrad in kinesiology there. And then weirdly enough, for me, deciding to go to physio school, since I live near Toronto, U of T was my only option. So in my head, I was like, this is going to be next to impossible. Like, it's so intense and competitive. I have friends that are still wanting to get in for physio school.
Really?
Yeah. Like, people have switched. I have a friend that's now just an HR rep because she went back to school and switched because she just couldn't get into physio.
Oh,
It's so competitive in Ontario. So I literally saw a flyer on the wall in undergrad that said study across the pond. And it was like, that's the company that it's called. And it said, it does all of your applications, does everything for free. And I was like, well, okay, why would I say no to that? So it was a big financial thing. Like, it had to be a big consideration, obviously. But it was one of the best experiences ever. Like, doing physio in England, the type of physio I like, the very hands-on exercise, very much evidence-based stuff. That's very much like England and Australia are huge for it. Canada's is like a little bit behind. So like the way I like to do physio, the way I like to consider things in physio are very different to how you're taught in Canada. So that was like one of my main points too, to go. I felt like I just would fit in there better.
So what would you say is kind of the main differences between more of a, we'll call it a Western, North American way of practicing physiotherapy versus a European model of physiotherapy?
Very conservative. There's machines. That's like the biggest difference between Canada and overseas or in general. That, like, when I was in school, I didn't learn how to do ultrasound or TENS or all of the bells and whistles. You're taught how to just kind of treat the person, which I do appreciate that can take longer in some cases. But if you know how to treat someone and you know how to do the pain management without having to use a machine, like, I can use my hands for that rather than have to rely on something. I feel like it gave me a huge like scope and like a different lens onto practice because I have to figure it out. I can't just be like, oh, there's inflammation, I'm gonna put an ultrasound machine on them. Like, I have to be like, how can I like manipulate this person to help their inflammation come down, to help them get better without having to have a clinic that spends tens of thousands of dollars on machines.
That was something that I found as well, like in the strength and conditioning field, Europe, Australia, that was where a lot of the more in-depth in vivo research, like there was no GPS research being done in North America. There was very little force plate research being done in Canada. Anything that you wanted that was sports science was coming out of Europe.
Yeah.
I've always been curious as to why that might be. Because you'd think like North America has more money, North America has more people.
Yeah.
But it's always been the case that the practice of strength and conditioning and rehab has been very much research and evidence driven in Europe more so than here. I'd almost look at the North American model as like, it's like a conveyor belt.
It is.
Like,
and that's the same thing in clinics here that is probably my biggest pet peeve. And they're just like patient mills. All you do is get a patient in the door and then you treat 2 or 3 people at once and you are just going like crazy. You always have a ton of assistants and stuff. And thankfully at the clinic I'm at, which is probably my best case scenario in life, is where I'm working, we don't have assistants, we don't have machines. We all are just a bunch of like nerds that love movement and love rehab, and we all just play around with it, find ways to help people without having to rely on like external factors more so.
Do you feel that that does limit your ability to help? Because obviously technology is phenomenal, like the ability to use these machines. I mean,
Yeah.
I'm sitting here hooked up to a PEMF machine 4 hours a day.
You're a
Um,
very special case though.
yeah,
You're a
fair enough.
special one.
But but that's got to play into it somewhat. I mean,
Hmm.
are all of these modalities horseshit?
I don't want to say horseshit because they do have the time and place. It's not
Horse
like they're.
poo?
Yes, we're allowed to swear on here, right?
Yeah, yeah,
Of course, it's your podcast.
yeah.
No, there's definitely a time and place. Like, I don't really treat a lot of the elderly population. I do actually have a few people that our like methods and way of treating really help.
Okay.
Um, but I can very much appreciate that the pain management that you get from a TENS machine, or just even, let alone the actual evidence besides, say, like an ultrasound machine, the placebo effect of that is huge. Of someone just knowing that you are actively trying something and putting something on their body to help them, that can make a really big difference in patient care. Whereas I have to almost convince people, like, no, we don't have a machine, but this is the basis of my treatment. This is why I'm doing it. This is how it'll help you. And you kind of just have to build that trust with your patient and hope that they're like, okay, that makes sense. I'm gonna take that and run with it. Sometimes people, I'm like, you never know, this might not work for you. So we're gonna try it for a couple of weeks. If it doesn't work, here's the resources I have, and here's who I can refer you to in case there's like something else that I'm missing that you can go and see with.
There's quite a bit that we could tease out from there. I think number one being the ability to create a rapport and a relationship with the person that you're working with, because I think
Yeah.
that goes such a long way. As
Yeah.
soon as you have their trust and they understand that you're a credible practitioner, being able to get to tell someone, "Hey, I think this is going to help you," and them to be fully bought in, that in itself is a skill.
It's a
And I think,
very, very, very rewarding feeling too.
yeah, I
Like
can
I'm happy
imagine.
that
Yeah.
the patient is happy, but for someone to trust me enough to just be like, sure, like I'm just gonna agree with you because it's you, and then they just want to try stuff. That's like probably one of the coolest moments in my career. Is that when it first happened? Obviously, I was like, this is amazing. But the more you see it with patients, it's like it almost gives you that like imposter syndrome cure that I'm here for a reason. I know what I'm doing. But now I have that like validation from my patients that they're like, no, you do know what you're doing. Like so it's very nice. I like that.
The other thing that I think is important to pull out of that is you also operate in a fully private practice. You don't do any sort of insurance billing,
No,
correct? So, one thing that I found having worked in the insurance field, fun fact for people listening, I worked in
I
disability
didn't even know that.
insurance. Really?
No. I
Yeah, I
just thought you
spent
were always
six
like the
years.
S&C like muscle
No,
man and
I did. I was in collegiate strength and conditioning until 2014, 2015. And then I transitioned into 2015. And then I just transitioned and I left coaching
mm,
and I got a full time real job as a disability rehab coordinator for Manulife Insurance.
I
So I was,
can't picture you in that
it was different.
realm.
It was different.
Yeah.
I was also a lot different back then. You know,
Yeah.
you think that I'm a hard ass now. Imagine, you know, without 6 years of experience learning how to communicate with different populations and
Mm,
dealing with mental health issues and things like that,
yeah.
um, it teaches you a whole new level of relationship building. And one thing that I did learn through that process is it's very challenging to bill insurance for the unmeasurable effects of hands and words.
That's
So,
fair.
one of the reasons why a lot of these clinics will opt for more passive rehab modalities is because there are research papers to validate their efficacy
Right.
in certain dosage ranges, in certain frequencies, where the insurance company is confident that the money we are spending is leading towards some sort of supported outcome.
Right.
And when you're operating in that sort of model, if you're a practitioner that's saying, no, we're gonna use my hands, we're gonna use
Mm.
coaching, and we're gonna use exercise, that's not necessarily quantifiable.
Right. I mean, on the
So that
flip
is
side, because I don't have research behind this, But the clinic I was working at when I first moved to Calgary,
Hmm.
we use machines for everybody. I was told you have to use machines. And, like
Right.
that was a no-brainer. All of the patients we were seeing had been there for almost like at least a year. Almost all the motor vehicle patients at least a year. My patients now, I've just since working at my clinic for almost 8 months now, like I've discharged so many people. So I don't have the actual papers to back it up, but it's
Right.
that time and place thing that
Yep.
sometimes the machines make somebody very reliable and they have to keep coming back because they need these machines.
Mm,
Or as I can provide more of that independence into somebody that you don't need to come in and see me. I tell people all the time, I'm like, I love you, but I don't want to see you. Like, if I don't see you often, I'm doing my job. So
wow. That's a
it's
challenging business model to scale,
it is, and
right?
it's
So if
very
you're,
like it's not black and white. It's very much back and
mhm,
forth. Like I would never say that a physio who likes to use passive modalities more is wrong. They're just different. Like it's just not
they're
how
just
I
terrible.
personally. They're the worst. But we have to be political on the podcast. No, but there is I have friends that work in clinics or in hospitals that use stuff like that. And I would never be like, you suck. You're the worst because you don't think like I think. We're just like two sides of like just two different perspectives onto physio. I think that's just cool. Like physio is so broad. It's not just like this is how you do it and they're gonna get better. Like I can have two patients with the exact same lower back pain case and they respond completely different to treatment and they need completely different exercises because it's never one route.
Yeah, I really love the fact that as a physio, if you have the education and you have the experience
Mm.
and you have the toolbox, the ability to have an integrated approach is something that is incredibly useful because
Yeah.
if all you have is a hammer, then everything's a nail. But if you have a
Yeah.
full toolbox of maybe passive modalities, active modalities, exercise therapy,
Yeah.
you can put together a very individualized rehab intervention for
Hmm.
somebody and
For
really
sure.
create some results. Like I'm looking at, the situation that I'm in. I'm working with a physio named Ryan Morrison, who I'm going to work to have on the podcast.
Mm.
We're in the clinic. He's doing a little bit of manual therapy on me, making sure that my patella is moving well. He hasn't stuck me on a single machine yet.
Yeah.
We do BFR, we do some mobilizations, and he sends me out the door, and the
Hmm.
passive stuff I do at home because I have it. So
Yeah.
the muscle stim, the PEMF, even passive stretching, I can do that on my own. I don't have to do that in the clinic. So we can do
Yeah.
the exercise stuff and the active stuff in the clinic.
Hmm.
But again, fringe case. You're not going to trust every person to spend. I think I spend 7 hours a day doing some sort of rehab.
That's crazy.
Yeah, but I
That's
want to
insane.
fucking walk, Carly.
Well, I know you had your little feet in the pool. You
Oh,
were.
that was fun. That's another active thing that I can
Yeah.
do. But
Yeah.
I think that integrated approach is something that's really really interesting. So let's return
Hmm.
back to studying abroad. What are some of the other main differences that you saw clinics and practice overseas versus here? Like, do they have a similar insurance system over there?
They're a bit less private. You see a lot more of like their like the NHS, their I think it's called National Health System or whatever. Um, that is where the majority of what I did through my placements and through my work there was through the healthcare system, which sucks because it's just like in Canada that it just is very slow and you don't get as good of care because they don't have as much of a budget and you don't have as much time with your patients. Um, Most of what I did was hospital because it was mostly through school for placements, and you had to have like a certain amount of hours in a certain amount or different fields. And then I did like pitch side work for a couple teams, so that's where I got like my more like athletic sort of stuff. But I love, like, I didn't love it while I was doing it, the hospital work, because it's
Right.
boring to me. I'm too like ADHD on everything in life that if you tell me to go to a building with beige walls and just walk with a 70-year-old person after a surgery, I'm like, kill me now. Like, I don't like it. So now, if you see me at work, and I get made fun of for some of the conversations I have because they're the most random. I can talk to a wall for 4 hours and be so content. So, but the hospitals, it gave me a very big outlook onto patient care and someone who, like, I mean, similar to you, you're just on that severe side of the spectrum that people who just can't care for themselves at that time.
Yeah.
And whether they're a young person or they're an old person, no matter what, they just came out of a surgery or some sort of intense moment in their life, and you're one of the first people they see. So I think that taught me a whole lot of empathy, a whole lot of like understanding and compassion for people, because like my last placement was called limb reconstruction. So someone that's had like a really intense fracture, say like a fracture in their femur that's like
Okay.
shattered. If you've ever seen where they have like the little wires like into someone's bone and the big like circles
Right. Yeah.
around their
Yeah.
limbs, those were my
Yeah.
people for a
Oh,
while.
wow.
And you can walk with those because the wires hold, I think it's like 100 kilos per wire it can be tensioned up to. Um, so I had literally people with like a fracture of their shin, and we had a Smith machine. I had people squatting, I had people moving. We'd still do like passive like stuff with them for pain management, but those were people that like had the worst like stories. I got run over by a car. I was on my bike on some massive triathlon. I got hit by a car. I like had just the craziest stories to listen to and have to process that and realize like, man, your mental health is just as important as your physical health right now. So to balance that was like very confusing at first. But now I think I've taken these skills and been like, now if someone comes to me being like, Carly, I've been in pain for 2 years, like I'm sick of this. I'm so done with being in pain. And
You
then
get
two
it.
weeks later they come back in and they're like, I feel great. I've never been out of pain like this. And that's not just from treatment. That's from me just listening and understanding their story, their mental health, which I think a lot of people, especially if you're comfortable as a physio and you've been working for a long time, you almost like, not on purpose, but you start to lose some of that compassion and care. You just go through
For
the
I could totally
motions.
see that.
And I don't want to ever be like that. But I think that's where a lot of like physios can miss the mark is that they know, okay, someone has knee pain. I know this is going to work. I'm just going to do it. And they forget about the human in front of them that's in pain.
So that's a really timely subject for me to talk on because,
Hmm.
you know, number one, yeah, my accent was pretty crazy. I could not imagine if I didn't have the upper body strength that I do and the core strength that I do
Yeah.
to be able to move around and do transfers. Like I remember the physio and OT came to see me the second day. And they're like, "Hey, can you transfer into this wheelchair, transfer into this commode?" I was like, "Sure." And I just like threw myself into it. And they were like, "What the
I can
fuck?"
picture that so clearly.
And they're like, "Okay, I guess we're fine." And they
Mm,
left, and it was like, okay. But and the other thing was like, my mindset was pretty positive throughout the whole thing because I knew I was fucked up, and I'm a very much like I practice acceptance. It's one thing that I actively work on. So
hmm.
I wasn't depressed, and I wasn't moody, and I wasn't angry, and it was almost they would approach the conversations expecting that, but they didn't get it, and there was a surprise to them.
Oh,
But I
yeah.
could totally see, especially if you're in a situation where your patient or your client is in pain, but you've seen someone in way worse condition overcome it. You're like, you almost want to minimize that person's experience.
Hmm. Yeah.
A line that I always return to is the hardest thing you've ever done is the hardest thing you've ever done.
Yeah.
So whenever you go through hardships, you're comparing that hardships to whatever it is in your mind that is somewhat on the same level.
Hmm.
And for me, I would say that I've been through worse emotional hardships than I'm in currently right now.
Right.
I also have a lot more coping strategies than I did back then. So
Hmm.
it's not as bad to deal with, but I could only imagine say someone had the same injury as me, but they got it from a car accident or something like that. And
Yeah.
they didn't have the story that I have. And the mindset's completely different. I think that
Hmm.
rehab trajectory completely changed.
For
Can
sure.
you speak a little bit to like maybe even the broader sense of mental state, motivation, cognition on rehab outcomes?
Yeah. I think it's the tail end of what you said of like just the upper body strength and the core strength that I didn't fully understand and appreciate until I noticed how little people can move. Like in
Mm,
my eyes, especially at the end of kinesiology, like someone who does kin thinks that they know literally everything and exercise is king, and you're just so young out of undergrad that you don't fully get what's happening. But the acceptance of understanding like how little people have strength day to day, like someone who just never goes to the gym or someone who's in their 50s or 60s that has just never exercised before, obviously they're not going to be able to put their arms on like a wheelchair and like lift themselves and transfer. But when I first started to be with those patients, I was like, never said it to them because I'm not that evil. But in my head, I'm
Hmm.
like, really? You can't push like that? And I look back and I'm like, that was probably the worst physio moment of my life, is that I actually thought that to myself. And looking back, like, I'm happy that almost happy that I did, so I can learn from it. Because I think that plays a big role into their mental health and motivation. If you go into a room and without you actively meaning to, you're almost like being demeaning to these people because they're not as strong as you are. And I was like a
Right.
power lifter that could bench a lot of weight, so obviously I'm the strongest in the room. So like I think that and almost meeting them at their own level helps with motivation and their mental state. If you're just constantly telling them, like, ah, you'll be fine, you'll get there eventually, like, there's nothing to worry about. But they're sitting there being like, I was just in this massive accident and you're telling me that I'm just okay and you can walk out of this room and be okay.
Mm.
That's not nice, and it's not a way to practice compassion. And I did have a few people in physio school that I did not get along with because they had zero empathy for patients, and I could not deal. I'm like, I no, I can't be in the same room as you because you make me sad. You make patients sad, you make me sad. So I think, like, not to toot my own horn, but that's one
Oh,
of, like,
please toot away.
please toot all the toots. I think that's one of my favorite parts about me as a physio is I just love, you know? You just need to be
Mm.
nice to people, and pain sucks. There's so much neurological side to pain that you have to consider. So if you can just make them happy while they're in pain, that can make a huge difference in somebody's rehab.
Have you ever been in a situation where you were treating somebody and for all intents and purposes they should have been getting better,
Mhm.
but cognitively, emotionally, they were just holding themselves back, maybe like fear or something along those lines?
For sure. Always. It doesn't it's like I was taught two different like coping strategies where you have someone who's like an endurance coper who there will just push past all the pain. They'll feel the pain, they'll be like, I don't care, I'm just gonna do it. Then they'll find like compensation patterns and like get worse off in that way. Or you
Hmm.
have the avoidant coper who they feel pain and they run from it. And you don't want to be either end. You need somewhere in the middle to be able to truly get better, which is way easier said than done. I'm both of those copers, but I'm still in pain. Like I have shoulder issues and I know it's an issue, so I'll just push past it because I'm like, I know what's happening, but without realizing it, I'm avoiding a lot of positions so I don't get into pain. So people who are either side of those coping strategies, they often are stemming from their fear of movement,
Okay.
especially the avoidant people, because they feel pain and people are taught when you have pain, that's it, don't move. Like you're going to hurt yourself more if you're in pain. Whereas you have to kind of meet them halfway and say, like, go into like a little bit of pain, like a 3 to 4 out of 10, I'm okay with. But if you're to the point that you're like biting your lip in so much pain, you've gone too far. You need to pull yourself back a little bit. So for those fear people, it's very difficult to find that like middle ground where
Hmm.
you're not just telling them pain's in your head, but you're not just kind of forcing them to push through the pain anyway, sort of thing.
Let's talk a little bit about populations in that because I feel like there's definitely a propensity for more endurance coping strategies with athletes.
Hmm. You'd be surprised.
Whereas, okay, tell me, surprise me.
They're both. Surprising. You it almost depends on the athlete. So if I get
Okay.
athletes that understand their body really well and they maybe have some sort of background in rehab or they've gone through rehab before, they're the people that will just push. And they're like for me, for example, I think I know my body so well and I know the human body so well that like my big toe starts to throb and I'm like, that's all I can feel. Because you will focus on it because you understand it the most.
Hmm.
Um, Whereas people who are more on the avoidant side of an athlete, maybe they've never been injured before, or they've had someone tell them before, pain is bad and you have to get away from it. So I think it's less so the fact that they're an athlete that they'll be an endurance person, more so their background as an athlete and how they were brought up, the type of people who were their S&C coaches, the type of people who were rehabbing them. Were they taught just like you're an athlete, you're going to be in pain, or were they taught you need to stop the second you're in pain and you have to go see somebody? So it's that lovely gray physio area that nothing ever fits in one box. And it's maybe the young people are more of that, the pain, they'll avoid it. But as you get like a more seasoned athlete or a more professional athlete, they will push through that. Like if you tell a Muay Thai person you have a fight in 2 weeks, but you're in a ton of pain, so you need to stop training so that your pain stops, they're not going to stop training. They're still going to be beating the shit out of people 5 times a week until their fight comes. So again, it's that halfway point you got to find with your athletes.
There is a balance, and like
Mhm.
again, the easiest way to conceptualize this for me is just to like bring it back to my current situation, and that like
Yeah.
I feel like I'm way further along in my rehab process than I probably should be according to like a traditional timeline, which makes sense because of all the stuff that I'm doing.
Yeah.
But I'm also getting like mentally really frustrated with the fact that I'm being held to the timelines that
six
my
weeks.
surgeon put in
Only
place.
6 weeks.
6 weeks. No, it's like something magical will happen. It's like I won't be healed until that magical 6 week moment.
Yeah.
But I'm still like I have to practice patience
Mm.
because I don't want to go through this again. I don't
Yeah.
want to risk re-injury. Even if that injury risk is very low, I'm having to find ways, okay, how can I push my recovery but also stay respectful of the guidelines? And
Hmm.
I'd be lying if, on last Wednesday when I was expecting to have my physio be like, all right, you know what? Functionally, let's see if you can do it. When he said no, I would be absolutely lying to your face if I didn't get incredibly frustrated and want to quit doing all the extra stuff.
Yeah. It feels like it's all for nothing because
It
you're
feels
not
like
getting that
exactly.
goal. Yeah.
But I also have the background to know that, okay, if I'm being held to the 6 week goal, the better I prepare right now, the faster I will recover after that 6 week timeline.
Hmm.
So when my feet do hit the ground, cool, let's go.
Yeah.
And I think that's only been able to be kind of drilled into my head because of the people
Hmm.
that I have around me.
Yeah.
Because if
Yeah.
it was up to me, I'd be fucking walking already.
Oh, I know you would. You would be on a treadmill by now. That's for
Yeah,
sure.
I would.
Yeah.
I
But
would.
that's very special too, like for you to be able to understand that by yourself you couldn't do this, but with a support system, people understanding you, you can do it. Like you are that like special unicorn that you have this
Thank
crazy,
you.
you're so beautiful, this
I
crazy
know.
support system that not a
Yeah.
lot of people have. And
True.
and you've been through one of the worst situations too. So the fact that your mindset is at where it's at, like that should be a big like pat on the back to you because that's not
Hear that,
normal.
everybody?
Yeah.
Hear
You're
that?
amazing. You're
Podcast
beautiful and you're
done.
strong.
um, I I want to switch gears now. Let's say you're dealing with an athlete. You've dealt with the clinical population in terms of more general population lifestyle.
Mhm.
Um, let's talk about the differences in training modalities and rehab modalities, or even rehab trajectories
Mhm.
that you would see put in place for that athletic population. Because if we're approaching this thing with multiple tools, we're creating an integrated approach, maybe that 6 week timeline or that 8 week timeline doesn't really apply.
Mhm.
How do you determine what's appropriate for your client while also covering your ass?
In a lot of guidelines, they put 6 weeks, but they also put in 6 weeks, this person should be able to X, Y, and Z.
Okay.
So that's how I kind of, because I don't like to just do things because I think it's right. I do fall into that every now and then. I think every physio will because you just trust yourself. But let's say I have a guy right now who we don't have imaging on him yet, but I'm pretty certain he has like a pretty big tear in his MCL in his knee, the ligament on the
Oh,
inside.
lovely. Okay.
And it was just a work injury. But he's also someone who loves the gym and everything. So he's not quite like an athlete, but he's athletic and he's fit. Um, and for him, when he first came in for an assessment, his knee was like a friggin' balloon, extremely bruised. And at that time, I gave him like, I'm like, brace yourself because I'm going to tell you probably about 6 to 8 weeks. That's my thought of like ish where we're going to be when the brace can come off, when you can start like fully weight bearing. But he came in to see me yesterday and his knee's almost back to the same size. His bruising is almost completely down. I'm able to push him a little bit more. So yesterday, he laughed at me because he was like, "You were wrong. You told me 6 to 8, but I know it's gonna be less." I'm like, "Yeah, it probably will be." Because I'm not someone that sticks to the exact week. For the most part, yes, because you have to be careful, especially in these situations. But if I know that he can do X, Y, and Z and we have imaging to back up how much is torn, how he's doing, that's where I would go. Because you never know, some people can get to 6 weeks and they're not ready, and you have to push them a little bit more if they're not good at doing their rehab. So athletes I find are very good at doing their homework because they have a reason to get better. They have a
Oh,
return to
good point.
play.
Yep.
This guy had just started trying to learn Olympic weightlifting. So now he's like, all he can do is upper and like right leg or left leg, single leg work because he can't use his right leg right now. So he's like, I was just understanding it. I was just starting to have fun with it. And then he's at work and blows his knee. So
Stupid work.
idiots. You might as well just never work again. That's what I think. Anyways,
That's why I do what I do. I never have to work again.
that's fair.
I just sit at my
I want
desk.
your life. I just sit at my desk. um, but on the flip side, when you have a Gen Pop person, they often don't have an actual goal to get back to. Like maybe
Okay.
in the summer, like Calgary's so big, there's so many golfers in Calgary. So I have a lot of just like run of the mill people who are like, I can't golf because my back hurts so much. I can't, just like walking the course hurts them. So I'm like, okay, that is your goal. That's what we need is to get you back to golfing a couple times a week. So for Gen Pop, I find it a bit harder because you have to look for a goal, whereas athletes just have a goal. So if you're a desk worker that likes to golf on the weekends, like you're not actively like trying to get back to that golf. You're like, I just can't golf right now. So that's where it's kind of hard.
I feel like that would be so hard as a
Excuse me.
provider because
Mm,
bless you.
thank you.
Because you yourself are so goal driven. So to have a client who isn't
Yeah.
like that would it
Yeah.
boggles my mind. Like I'm as silly as like my goal right now for
Mm.
rehab is to get back to training so I'm not fat.
Honestly, I am the same way. I have had to treat, and in the nicest way possible, had to treat some large humans who are in their 50s and 60s and in so much pain. And I always tell myself, I will never, ever in a million years get to that point. I will do everything I can to do that. I've told Gino, my darling boyfriend, that if I ever get to that point, I give him permission to smack me across the face and give me a reality check that I need to be healthier. Um, Maybe just because I see how bad it can be if people have bad lifestyles growing up. Like, you got so much arthritis, you have so much, like, just pain for no reason. And I'm like, I already have pain from weightlifting, don't need more. So I will do what I can. And that maybe that's in the same way, that's kind of my goal too, is yes, I want to be strong and I want to win competitions, but I also don't want to have a cane at 50.
Well, I'm pretty sure that I'll probably have a cane at 50 because I did
Yeah,
the
but
things that I
you're
did.
silly. You're the unicorn. Don't forget it.
But on the subject of like getting fat, you know the question that this is totally off topic and I
Oh
don't
no.
care.
Here we go.
You know how in general it's usually wives will ask their husbands, "Would you still love me if I was fat?"
Yeah. Do you guys live that?
She's asked me that and I've
Oh.
straight up I said no.
Oh. I mean, I know what you mean though. I get what you
Listen,
mean.
this is, you know, we can be as politically correct or incorrect as we want because there's like
Mm.
6 people who listen to the podcast. But if you are if you fall in love with somebody who is fit and active and cares about their well-being, and then they stop doing those things and gain a ton of weight, have they not changed as a person?
True.
There you go.
Yep.
Um, and the reason I bring that up, it was definitely an off-topic statement, but I think your identity as an athlete plays a huge role in the way that you overcome hardships.
Oh yeah.
Um, Being someone who purposefully seeks out hardship in my life to overcome, to fortify myself, this is just another one of those things that makes it much easier to
Mm.
accept. But if you haven't built that sort of identity and you encounter a hardship that is on a scale beyond anything you've ever encountered, I couldn't imagine like Or what if God forbid this injury prevented me from ever returning to athleticism? Have you ever encountered anyone who, you know, it wasn't returned to sport, it was returned to quality of life?
Um, a lot of like low backy people I find are like that because I find low back pain, it's so common, but it's so debilitating for some people. Like a shoulder, just use the other shoulder. Like even knees sometimes, like you'll be able to walk a certain way that you don't load it so much, but your lower back obviously is so central in your body. It holds so much weight. I think it's like 4 times your body weight or something. So anybody with lower back pain, they're like, I turn over in bed and I'm in pain. I every time I stand up after I wake up, I'm just so stiff. It hurts so much. And it's just the little things in life that you take for granted that they just can't do because their back is so tight and so stiff and so painful. Um, they're the type of people that it's like, that's kind of my audit for them. Like when I see them a week later, I'm like, how many times a week did you wake up this morning and you could just walk without pain? And then when they think about it, they're like, oh, no, actually, like two, three? Like, okay, that's 2 or 3 more than last week. Let's build on that. So whatever we're doing is working. What do you like? What do you dislike about what we're doing? And how can we fix it? Um, I find making it very collaborative is very big for people who don't have a specific goal, or it's that quality of life return. Because if they just kind of like keep coming back all the time and you're just like, yeah, you're getting better, like they don't understand that. You need to like have this like quantifiable thing that they can understand and track for you. Um, but also that collaboration. Like I tell people at every initial assessment, I'm like, these are the exercises I currently think are going to help you. This is trial and error. If you hate an exercise throughout the week and you're like cursing my name while you're doing them, don't do them. Just message me and be like, Carly, you're dumb. I hate this.
Switch
And
it
I'd be
out.
like, fair. Please don't yell at me. I'm fragile. But like I'm like I say it to almost everyone now. It's like my little mini script almost. I'm like, I am not your boss. I'm not here to tell you what to do. I'm here to help you with what you should do or possibly could do.
Hmm.
So I don't want you doing an exercise because Carly said so. Like, you're not going to get better because you're not going to like it. You're not going to enjoy the process while you're doing it. And then you're not going to come back and see me because
Right.
you're not going to find our sessions productive. Um, so I have had many patients come to me and it's almost like they want to tiptoe around it and be like, I really hate doing this. Like it doesn't feel like it's working. I don't like it. And I'm like, please speak up. Say it louder for the people in the back. Like tell me you don't like it. Because
Hmm.
like I'm not okay, yes, I'm in physio for the money because I'm a human and I have a job, but I'm not the person to be like, I have to see you weekly for 8 weeks before I can even see if we're improving. Like
Right.
my average is seeing people weekly for probably about 3 to 4 weeks, and that's sometimes on the higher end. And then I'm
Hmm.
like, okay, see me every other week. And then a lot of people come to me for maintenance. They come in every 1 to 2 months for like a tune up. And that's my like ideal situation. So that collaboration with someone that just wants to walk with their kids at the park. They just
Hmm.
want to be able to just move around and not have to think about their lower back. They're almost the more fun ones to treat for me sometimes. Cuz
Well,
like
that's a powerful motivator.
yeah, like it's
Like,
cool if you can get back to sport. That's great. I love treating athletes. But for a mom that has given birth 3 months ago and she can finally lift her like newborn without
hmm.
pain, to me, maybe because I'm a softie, like that's absolutely huge to me.
No, I totally see that. And I haven't said this, I don't think publicly. Said it to a few people who have asked me, but like a huge motivator for me is not to return to powerlifting. It's not to return to bodybuilding. It's so that when we start a family, I can play on the ground with our kids.
Yeah, exactly.
Like to be able to get down on the ground and play with our kids on the floor.
Hmm.
Even before I got hurt, getting me down on the ground, like trying to get down to do a floor press and then get up to load more plates, like it was
Do you have to
awful.
like log roll and like
I
get
kind
to
of
your hands
like
and knees and then
I kind of like throw my hands forward so that I can sit up, and then I'll rotate, and then I'll keep my legs really wide and like walk my hands
oh
up.
my god. That's so funny because you are so strong. Yet that's how you get off the floor. It's just that like parallel of like you can be one of the strongest people, but
Yep.
also life is hard, you know?
Life at 250, 255, 260 pounds. That's a lot of weight to be moving around.
Yeah.
Even if it's functional bulk, it's still it's still muscle mass. And
Yeah.
so let's shift the conversation to more like actionables.
Mm.
Talked a lot about the cognitive side, talked a lot about the treatment side, having a toolbox. Let's talk about how we use that toolbox. So
Mm.
what are, like, if we were to draw out kind of a runway of progression for somebody, obviously it's going to vary based on the severity of the injury, vary based on the severity. um, Take me through a bit of like a runway of from triage up the chain to return to activity.
Yeah. So assessment wise, a lot of my assessment techniques also feel like treatment. So it gives me a really good idea in my first session with somebody how they're going to respond. And I try to take whatever has helped them on the table, I then recreate that at home. So in my head,
Okay.
that's like that direct, and it helps with the patient buy in as well. Because it's like,
Right.
I'm not just giving you a clamshell because that's what the guidelines online say. Like, I'm going to give you something that's specific to you and your sport, but that I've also known if I make a change at this like musculature in this area, then
Hmm.
I'm like, okay, now stand back up. How do you feel? Oh my God, my pain's gone. I'm like, it's like I take a magic wand and I like take their pain away. Anyways. Oh, I'd like to
You
say I'm
need to bring a
magical.
magic. You need to bring a magic wand with you to all of your assessments.
I should. People
That'd
have
actually be a
said
really
that it
good.
feels like magic. So I don't think anybody who I work with would be surprised if I had a magic wand.
Or if
That's
you had like
who I am.
Dorothy, like Jordans that had like Dorothy heels, that you click your heels 3 times.
That could work because I
It could
refuse to
work.
not wear nice shoes at work. So it has to be nice.
You don't
Um,
wear like loafers
no. Ew.
or office shoes.
My beaters at work are a pair of dunks. Like, that's the shoes that keep at work in case I forget to bring some.
Nice.
Anyways, I digress. So yeah, assessment wise is an idea for me to get a level of their pain and of their
Okay.
current function, of
Okay.
how much strength they have in certain ranges, where they need more strength or where they need maybe more range of motion. So it's like is it a capacity issue or is it a strength issue currently?
Hmm.
Um, and then from there, I give like my guess at the assessment. I'm like, this is what I think we're gonna do. This is my like treatment plan that I'm expecting out of you.
Okay.
I'm like, we'll do weekly for a couple more weeks. We'll see where you're at. If your pain is down consistently and you're actually feeling good every day and we're hitting some of those goals that we've set out in the beginning, then I want to see if we can push it, make you a bit more independent. So let's do every other week. And same thing, I'm like, I am always a text or an email or whatever away. If 2 weeks ends up feeling like too much for you, you just call me and we get you in earlier. But I want to try and push you to be more independent on your own,
Okay.
doing your exercises, self managing, with just having me as like a resource. Like, people will message me and just be like, what do you think about an RDL for my pain? I'm like, heck yeah, man. Go do it, try it. If it doesn't work, we don't do it yet. Maybe you're just not ready. Or we'll review it next time I see you. Um, so I try to give them kind of my estimation of how long I want to see them for. Um, if it's not like an actual, like that MCL guy or someone who's like ruptured an Achilles, that's very different. That's like protocol
Hmm.
guidelines, like what you're going through. For
Hmm.
these people, I make it very clear that I could be very wrong about the treatment plan. Maybe we're going to see you weekly for a month or 2 months because your pain just is like nagging at you, or you're gonna get strong and you're gonna be able to have like a couple weeks of follow-ups and then we can just start to self-manage and just get you really strong. But understanding that strength doesn't get built in 2 weeks. So
Hmm.
it's you're not consistent for 2 weeks because you're seeing me weekly. You're consistent throughout this entire treatment plan. And then when you're not even seeing me, I still want you being consistent.
Right.
Um, so I think the biggest benefit to that treatment plan is that there's no guessing to the patient. They don't
Hmm.
leave the appointment being like, I feel better, but how long am I going to feel better for? How long is this actually going to take me to get better? And they have all of these questions in their head that me personally, I wouldn't then email my physio and be like, I need answers. I would just
Right.
spiral in my own brain and figure it out, which could very much make people worse because they're hyperfixating on what's happening.
Yeah. I totally agree with everything you're saying. basically, like from an assessment standpoint, I really try to look at it personally. I'm not a clinician by any means. I just try to play one on the internet. Um,
It's like playing
I basically
Joseph.
look for like, hey, what capacities do you have? What makes it worse?
Mm.
What makes it feel better?
Yep.
Let's try to mimic the things that make it feel better, and let's try to make those things that feel worse feel a little bit less worse.
And that's, you literally just described physiotherapy, which is why that blurred line between
That's why I
rehab
started a
and
university.
training. Yeah. Like rehab and training, there are so many physios that want it to be black and white and they're like, they're not the same
Mm-hmm.
thing. I'm like, yes, they are. Because
They are.
when I give someone an exercise, I'm not telling them like to do a clamshell, which I hate the exercise if you can't tell, because it just never is beneficial for a lot of people. So I make fun of it a lot. Anyways, I'm not gonna give someone that because I forget the exact quote, but one of my colleagues taught this to me a while ago, where he was saying, if your daily life is the hardest thing you do, you need to do something harder. Like if you walking around the house is hard for you, then you need to find something that's harder than that so that walking around the house isn't as hard.
It's a
Like it's,
stimulus response, right? It's a
yeah,
stimulus. And so
yeah,
that's, you hit the nail on the head. You're like, all we're trying to do with rehab or training, and I think the continuum is essentially just a continuum of scale of stimulus, right? The stimulus either gets more frequent, it gets more intensive, or it's longer
hmm,
duration. And the difference between a bird dog versus a single leg RDL
mm,
is just the fact that one is completely supported by the ground and resisted by your body weight,
yep.
and the other is stabilized through one limb and loaded.
Yeah.
So it's the
This,
same movement.
yeah. Which side note blew my mind when I first like fully recognized that before. Because I never, because to me, a single leg RDL was like a balance, hip, glute, like stuff, hamstring stuff. And a bird dog was like the more like core anti rotation stuff. But then I don't even remember who pointed it out to me, but someone used that as a progression once. And I was like, oh my God, it's literally the same
Oh my
thing.
god.
You're just, oh, it's like a brain blast. You ever watch Jimmy Neutron as a kid? Oh,
Oh
wait.
my gosh.
We're not from the same generation, so I don't know.
I know Jimmy Neutron only because
Oh,
I have younger cousins
okay.
who do that. I
Anyways, I
am
love
not
him.
that old. I am spry.
Yes. Anyways, moving on.
Well, when I think, returning back to the idea of a spectrum between training and rehab, and that just being a spectrum of stimulus,
Mm,
that stimulus can be so many different things. We talked about the stimulus could be stability, the stimulus could be
mhm.
load, stimulus could be base of support, stimulus could also be different types of rotational vectors,
Yeah.
and it's up to your creativity to prescribe the intensity and the locus of stability that's going to allow your client to perform it with
Hmm.
good technique and to provide the stimulus to the areas that you're trying to strengthen or open up range of motion. um, how do you feel about stretching?
I like stretching if you add some sort of contraction in it. So, stretching itself, unless you do it every single day religiously for a certain amount of time, whatever a textbook will say, that's the only time you'll get benefit from it. But when you stretch, you take your muscle fiber and it stretches, and then about 2 to 3 hours, she's right back to what it used to be. But if you take a muscle and you stretch it and you add a contraction in this lengthened position, the muscle
Hmm.
can then create like an adaptation in that length.
Okay.
So think of couch stretch. I love a couch stretch for like getting
Hmm.
like big rec fem, hip flexor in general.
Hmm.
Um, a lot of desk worky people or hockey players too. Anyone who's always like stuck in hip flexion for longer periods of time. I love getting that stretch, but I don't just do a couch stretch. You have to get in your couch stretch, and then if your foot's on a wall, you're gonna kick into the wall for 10 seconds. As hard as you possibly can. You want to feel your quad feels like it's like ripping almost. It's not pleasant, but it's nice. Then after about 10 seconds, you then relax and you push yourself that little bit further into the stretch, and then you go again. You kick for 10 seconds, and you're contracting in a lengthened position, which is creating that adaptation, that change in your muscle. Whereas if you just sat in a couch stretch, especially people who just sit in stretches with no intent behind it, like they
Hmm.
just they're on their phone and they're just chilling, not like pushing themselves into a stretch, you're not going to get anything out of it. So if you add a contraction, it also just makes them work harder and actually do it properly.
For those listening, this is the time that I get to flex my intellectual muscle. That is called proprioceptive neuromuscular facilitation,
Oh my
ladies and
gosh.
gentlemen.
That's exactly what it is. I just, I don't like big words.
That's okay. You'll learn.
Big
You have to
words
use
scare
big
me.
you have to use big words on the internet so people think you're smart.
Nobody on the internet thinks I'm smart, so I'm okay.
You're not really on the internet. So
Exactly.
there I found there's like two types of people on the internet. There's the people that use big words to make themselves seem smart, and the people that actively avoid using big words so that they so they look even smarter.
Yeah, that's true. Yeah.
Right? Because
I
the
just
person
avoid
who
it at
can
all
explain a
costs.
really complex topic in a simple way that's easy to understand,
Yeah.
way smarter than the person who has to use a big word.
Oh, yeah.
It's like you're going to, what we're going to do is we're going to do a functional overcoming isometric and then
Oh,
into a loaded dynamic movement to take advantage of the post activation potentiation.
oh God. That just scares me.
It's like, bro, you're going to do an isometric, then you're going to jump.
Yeah. Yeah. But I mean, that's a big part of patient care too. If you're a physio that you're just like throwing words at somebody
Right.
without making it like digestible for them, they're never going to come back and see you. They're going to be
I
like,
totally
this
agree.
guy makes me feel like an idiot and I have no idea what he's saying the entire time. Why would I trust him with my life? Whereas for me, and then again, I get made fun of because I'm a loser, um, that I will make the weirdest analogies. And that's something I was taught as well, especially working with my clinic now. You need to find analogies that work for your patient. So, like, depending on what their hobbies are, what their lives are, if they're a mom, if they're a dad, if like, you have to make it digestible for that person. Like, I'm not going to give a hockey analogy to a 7-year-old woman with back pain. Well, you never know. I do have a 62-year-old woman who's a CrossFitter, and she just ran like a triathlon and everything. I want to be her when I grow up.
That sounds
But
pretty badass.
she also loves quilting, because so she's so wholesome. I love her. But whenever we're talking in the clinic, I don't even remember what I did, but it helped her because she had like elbow pain or something, and we related it back to quilting and crafting and all this sort of stuff. And it was like a light bulb went off and it clicked for her, even though I could speak to her in big words because she's a very smart, athletic woman, putting it into her like hobby and her just like stuff that she cares about more, it made a big difference. And she's just really
Okay.
cool.
We're going to use that as the perfect segue into the ridiculous part of the interview where I ask silly questions. What is a hobby that no one would believe that you have?
That no one would believe. I like to cross stitch. That's my favorite hobby.
Really?
I make like big, like, I wish I had one around here. I don't. Um, and yeah, me and my mom, every year, well, for the past 2 years, there's a convention in Brampton called Stitch North that we go to a hotel in Brampton, and it's literally the entire convention room, whatever, literally filled with just like men and women cross stitching for an entire weekend together. And you buy stuff and you show off your projects to each other.
Wow.
I've never said this on the internet before.
It's okay. I just became a Lego aficionado yesterday, so
Oh my God. I love Lego. Like puzzle, anything crafting. My mom's a very crafty person. Like she quilts, she does all this sort of stuff. So I obviously got it from her. But things like puzzles and Stitch and all. Oh,
I do enjoy a good puzzle. A buddy of mine came to visit yesterday and he said, "Hey man, I didn't really feel comfortable buying you flowers, so I figured if you could make them yourself, it would be less weird." So he gave me
oh
Lego
yeah.
flowers.
They're at Costco now. I was looking at them yesterday. I wanted to get some. Because puzzles are just fun. I just bought like one of those board thingies that you can like tuck it away because
Oh, I need one of those.
Gina would have a heart attack if I left a puzzle out because we have a very clean house. So
What
we compromised and we have a puzzle board now.
what are your top 3 favorite pairs of sneakers?
Do you want to see them or do you want
No, no, just tell me.
um I love Air Max 1s.
Okay.
They're probably my comfiest work shoe ever. I like the look of Jordan 4s. I
Okay.
have quite a few pairs of those ones now. Um let's just throw a high heel in there to be spicy because I do love being cute.
Like a
But this
Manolo
prevents me
Blahnik.
from being cute sometimes. Especially my job. You know how much I love strapping on a pair of heels now? Because at work I wear joggers and Jordans and I just look athletic. When I'm at the gym, obviously, like TMI moment, I haven't worn like a real bra in like a month.
Me neither.
Sports bras. You need one though. You need the support.
I do.
Um, so yeah.
Well, I mean, I had to wear a bra for like a month last 2 years ago
Why?
when
Did you get a
when I
boob
had my
job?
chest. When I had my boob job. I wish I was kidding, but
I know.
all right. What is one album you can listen to, no skips?
Hmm. Like currently or all time?
Either or.
I'm gonna do currently. There's a country artist I just found called Zach Top,
Okay.
and he's very like he sounds very old school. Like sounds like a Alan Jackson, Brooks and
Oh,
Dunn
like really
era.
like twangy.
Yeah, and I love him. He's got a little mustache, and he always wears a cute little button up. Yeah.
Perfect.
Now, almost every time I'm in the car, I don't even shuffle it. I just start at track one, and it just plays.
All right. Last question. Who is
Hmm.
one person that you would like me to interview on the podcast? But the caveat is you have to help me get them on the podcast.
I want to hear that the your physio guy.
Ryan?
Yeah, didn't you say he was like a there was a team he was on? The Leafs?
Yeah, he was with the Leafs. Yeah.
Yeah. Only because he's someone that uses passive modalities, but not the modalities that I am familiar with and use a lot.
Okay.
So he'd be fun to learn from.
I'm also trying to get Matt Nickel on. But
Yeah,
Matt's really busy.
that would be fun.
Yeah. I'm probably just gonna bring my podcast equipment to his gym when I bring the PEMF back.
Yeah.
And just be like, hey bud, we're on a podcast right now. Let's go.
Yeah, you don't even have a choice.
Yeah.
He's in the middle of a set and you're just like, drop it.
I'll like threaten to fight him with my skinny legs. I'm holding on by 1 centimeter against Liv.
Oh no.
My legs are
She's gonna
one.
pass. She's so easily gonna pass you. Look at her.
Yeah, I know. That's
Like,
why I need to start walking again so they can fill up.
it's not fair to us normal humans that she walks the earth.
That's true. It's
Yeah.
true. I get to touch it though. Wait, I said that out loud. All right.
On that
Any
note,
any parting words of wisdom for the audience? Something that you'd like to leave people with?
just go be strong.
Just go be strong. That's
That's it.
great.
That's the basis of rehab. Be
I will
strong.
have I will have some links to where everyone can find your non-existent internet
I post my
presence.
lifts. I post my training.
You do.
I
You
just
do.
don't like posting information on the internet.
I'll have links to where everyone can find you in the show notes. Carly, thank you so much for the chat today. I appreciate it. Very grateful to have you as part of the team and to have you as a resource for our athletes.
Yeah.
And everyone, thank you so much for listening. Please make sure to like, share, subscribe, and ring the bell for notifications. And we'll catch you on the next one.